Hi, everybody. Welcome. Thanks for watching. I'm Michael Quirke, and I'm back again talking with you today about attachment focused EMDR. Now, when I say EMDR, what is EMDR? That's an acronym that stands for eye movement desensitization and reprocessing. And it's a common trauma treatment modality. And attachment focus EMDR integrates principles from attachment theory into the standard EMDR trauma treatment approach. Attachment theory, if you're unfamiliar with it, is an approach that arises out of an area that we refer to as developmental psychology. It was originally developed by John Bowlby, and it was expanded on by others like Mary Ainsworth and other researchers and theorists. And attachment theory explores and explains how our early relationships with our caregivers shape and sculpt our later emotional and relational bonding patterns. Now, why am I talking about this topic today? I'm talking with you about this because I want you to have the information that you need to free yourself from the tangle of emotional suffering that is the result of traumatic experience. Recently, one of my clients referred to me as their emotional tour guide, which cracks me up. I love it. And as an emotional tour guide, there are some things that I know. I know that freeing yourself from the grip of psychological suffering requires a few things. It requires you're having a good, accurate roadmap that speaks to where you are and where you want to go. It requires having realistic expectations of the trek that you're going to be that you're going to be making, and it requires using the appropriate gear, the appropriate technology to cover the psychological terrain that you're going to be covering. Now, there is a troubling thing that I see in my clinical practice over and over for years now. I've been hearing from many new clients when they come in the door. In fact, almost every single client that's entered my practice has said something similar to me. And it is a common misunderstanding that people have about therapy in general and EMDR in particular. So let's take a step back. Broadly speaking, when you're dealing with trauma, there are really two types of trauma. There's something that we refer to as single incident trauma. That's probably pretty self explanatory. And then there's complex trauma, which arises out of repeated or enduring conditions and relationships. Now, in my experience, what I've seen is that single incident trauma, when there are no cofactors whatsoever, it's something that can resolve pretty quickly, and especially so with EMDR therapy. But here's the truth, that is that outside of research settings in which patients are cherry picked by researchers, that doesn't really happen so often. It does happen. I have seen it, but at least in it's something that I've rarely seen in my work. Most of the clients that tend to find their way to me have endured years of fear, pain, anger, shame, and most of that started very early in their life for them. So they're long-standing emotional patterns and bonding patterns. What that means is that if that's what you're dealing with, then recovering is definitely possible, but it's something that's going to take longer. So if what I'm talking about is similar to your experience, then expecting that there is a quick EMDR fix available is really setting yourself up for impatience, for frustration, and possible treatment failure, dropping out because you just didn't, You thought it was going to take longer. You thought it would be easier, faster, and that kind of thing. So this brings us directly to our topic today, and that is that EMDR needs to be specifically adapted if you are a person who's dealing with complex trauma or what I refer to as developmental trauma. Now, let's talk more specifically about what attachment-focused EMDR looks like. So first of all, it's different from the standard EMDR protocol, which basically focuses on the particulars of a single incident and the details involved in that, the sensory details, the body reactions, the emotional reactions, the thoughts, beliefs, etc. But in attachment-focused EMDR, we have a heightened focus on how your early attachment experiences influence your current patterns of relating to other people and the difficulties that you might have with emotional regulation itself. So we target relational themes more than just the details of one particular incident. Using attachment-focused EMDR, what we do is we privilege your specific attachment-related beliefs, your emotions, and your behaviors, your actions, all those things that underlie the roots of your current distress and difficulties. And as I've mentioned, we integrate attachment theory with EMDR. And that means that we take techniques from attachment theory and attachment focused treatments, and we integrate them with the standard EMDR protocols in order to enhance the therapeutic process. So this might include exploring how your early relationships were with important caregivers and loved ones in your life. And definitely, it involves focusing on what we call your internal working models of relationships and how these impact your present day experience with other people and even with life itself. Now, when I say your internal working models, I know that sounds a little jargony, so pardon me, please bear with me. But a simple way to put that is that we've got different sides of ourselves. A common way that people think of this is sometimes we have a very young part of us, an inner child, um, and that child, that young part of us, has an internal working model, a map of what they think the world is and who they are and who other people are, and again, what life itself is. So it's a map of meaning, and we can think of these as parts of your personality, or frequently they're referred to as schemas if you're familiar with that way of thinking. The next thing that we do in attachment-focused EMDR is that we focus on healing your relational wounds. And that's the goal. It's to heal your attachment-related wounds, the 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 hurts that come from the relationships you've been in. And we grow your ability to form healthier, more satisfying relationships, and also to manage your emotions more effectively. Overall, attachment-focused EMDR, it's an approach that provides you with a more nuanced and personalized trauma therapy approach. This is particularly beneficial for you if you're a person whose current difficulties are rooted in your early life experiences, your early attachment experiences. So, here's what I'm inviting you to do. If you're thinking about doing some EMDR therapy, I want you to reflect on the duration of your difficulties and ask yourself honestly, was everything that you've been through, was everything basically great for you, and then out of the blue, something terrible happened, like a car accident or a natural disaster or a fire, or maybe you became a crime victim. And I really put the emphasis on honestly. I want you to reflect on that. And here's why. Because it is very common that people who grew up in frightening homes where there was a lot of fear or anger or shame going on, they will minimize as a way to cope. They will minimize or deny what they went through. So it's very common that I have people come into my practice who really went through a lot as little boys and little girls, and they just say, "Oh no, it was fine. It's just a total normal family." And it's not that they're lying, it's that they early on developed a coping mechanism of just moving on, not thinking about things, not feeling things. I call it taking care of business, right? But with the blinders up. So that's why I say, I want you to honestly reflect on your life experience. I also want you to ask yourself if you have complicating factors in the picture, like depression, uh, present day relationship problems. Are you struggling with substance abuse and addiction issues? And I want you to think about the things that trigger you and ask yourself, is it really only one discrete traumatic situation that triggers you? The do you just get triggered when you're reminded of that? Or do you really have multiple traumatic experiences and much more general difficulties regulating your emotions? If so, then you're going to need to find a therapist who has more of an attachment based lens on their work. And that's going to be someone that thinks more holistically about you, meaning that it's going to be a therapist that thinks in terms of your global psychological development as a human being. And believe it or not, that's not how everyone in mental health care thinks these days. Many of us are focused on what I call fighting the symptom, killing off that depression, beating it, drugging it, getting rid of it, um, and and ignoring the bigger context of you, your life, your history, and how your struggles get fit into all that. Now, the approach that I'm talking about, fighting the symptom and without much context, it tends to really fail. We're not seeing great results from that approach. And that's particularly true if you are someone who's dealing with complex trauma. So, if you are searching for an EMDR therapist to help you, I want you to ask about their experience treating trauma. Ask them if they treat developmental trauma and complex trauma and get a feel for their background with that. Ask if they treat only single incident trauma and what their experience is with that. I say that because many therapists, they they only have a little experience or a little bit of training, or they have no experience of training in treating trauma of any kind. And so they might not be able to effectively administer EMDR, especially with a complex case. So I'm going to be talking more with you over the next couple of days and weeks about EMDR and attachment focused EMDR. I'm going to do a few more videos on this topic because I think there's a need for it. In the meantime, thank you so much for watching. If you found something of value, and I hope you did, please like this video, subscribe, share. I'd love it if you share your comments below. I find it really interesting to hear from people. And if you want to learn more, please look at my other videos. I've got a bunch of videos on trauma, developmental trauma, attachment issues, And visit my website. I've got a whole trauma treatment library there. It's www.michaelgquirke.com. Again, thank you so much for your time. I wish you the best. And again, hope you enjoyed this video. Bye.